Welcome viewers, Dr. JWA to the Irreversible Body Gamble. When medicine changed its direction. Viewers, medicine has never stood still. Every century has expanded its ability to preserve life, relieve suffering, and restore function. Antibiotics conquered infections that once claimed millions. Anesthesia transformed surgery from agony into possibility. Organ transplantation achieved what previous generations considered unimaginable. Progress became medicine's defining characteristic. Yet beneath these extraordinary achievements, another transformation was quietly taking shape. For most of its history, medicine asked a familiar question. How do we restore what disease or injury has taken away? And the patient's biological organization remained the reference point. A broken bone was repaired because it had fractured. Damaged skin was reconstructed because it had been destroyed. And lost function was restored because something essential had been impaired. The objective was recovery. But as surgical capability advanced, medicine acquired a different kind of power. It became increasingly capable of altering healthy anatomy, not simply repairing diseased or harmed anatomy. This was more than a technical development. It represented a philosophical crossroads. When medicine possesses the ability to reshape healthy bodies, how should that power be exercised? Should technical possibility alone determine medical practice, or must every intervention still be measured against broader biological, ethical, psychological, spiritual, and long-term considerations? These questions reach far beyond any one field of medicine. Cosmetic surgery, reconstructive surgery, reproductive medicine, genetic technologies, and other specialties all confront versions of the same underlying challenge, distinguishing what medicine can do from what medicine ought to do. And this distinction does not reject medical innovation. Rather, it recognizes that every new capability introduces far more diverse new responsibilities. The greater the permanence of intervention, the greater the importance of understanding its lifelong implications, spirit, soul, and body. Medicine did not suddenly abandon restoration, but it entered an era in which restoration and reconstruction increasingly existed side by side. And that quiet change in direction is the foundation upon which every remaining question in this series now rests. Because once medicine acquires the power to permanently alter healthy anatomy, every future decision becomes more than a surgical decision. It becomes a question about the purpose of medicine itself.